How to inject progesterone in oil, intramuscular. Presented by Fuze Health. How to store your medication. Progesterone in oil comes in a pre-mixed multi-dose vial. You may be prescribed a compounded or non-compounded version, but the preparation steps are the same. This medication is stored at room temperature. After the first puncture, it is good for 28 days. Supplies needed. You'll need 1 vial of progesterone in oil, compounded or non-compounded, 1 3 ml syringe, 1 mixing needle to draw medication, 1 injection needle, alcohol swabs, sharps container, gauze or tissue, optional. Examining your medication. Before starting, wash hands thoroughly, work on a clean surface, and inspect your vial. Progesterone can be colorless or have a slight hint of color, for example yellow, but the liquid should be free of floating particles. Prepare the medication. Flip off the cap from the vial and wipe the stopper with alcohol. If you have already used the vial from a previous dose, the cap is already removed, but you still need to wipe the top with alcohol before each use. Assemble your mixing needle and syringe. Pull back plunger to draw air into the syringe equal to your dose. Insert the needle through the rubber stopper at a 45-degree angle with the bevel facing up. As the needle is penetrating the stopper, increase to 90 degrees until the needle is fully inserted. This prevents bits of the rubber stopper from falling into your medication or coring. Press on the plunger to slowly inject the air. This makes it easier to withdraw the medication because the vials are pressurized. Invert the vial and withdraw your dose. Ensure the needle stays submerged by slowly backing the needle out of the vial as you withdraw. This ensures you are drawing liquid and not air. Turn vial upright and remove needle. Recap the needle by scooping the cap up with your needle to prevent needle sticks. Twist it off and discard it into the sharps container. Switch to your injection needle. Make sure you are attaching the correct needle. The mixing and injection needle look very similar. Tap out bubbles and push the plunger gently until the droplet appears. How to do an intramuscular injection. The upper outer quadrant of the buttock muscle is the most common location for an intramuscular injection, but always check with your provider to ensure you are injecting at the right location. Tips to reduce injection discomfort. Warm the vial or filled syringe before use. Ice the injection site before injection. After injection, massage the injection site and apply a warm compress. Rotate injection sites. You are now ready for your intramuscular injection. Clean the injection site with alcohol. Firmly stretch the skin at your injection site with your thumb and index finger with your non-dominant hand. Hold the syringe in your dominant hand. Insert the entire length of the needle into the stretched skin at a 90-degree angle with one swift motion similar to a dart. Stabilize the syringe with your free hand and pull back slightly on the plunger. If you see blood, do not inject the medication and withdraw the needle. Apply pressure to the injection site with a gauze or tissue and discard the syringe into the sharps container. Repeat your medication preparation process and inject at an alternate site. If there is no blood, the needle is inserted properly and you can inject the medication. Slowly push on the plunger until all of the medication is injected. Quickly withdraw the needle and discard it in the sharps container. Apply light pressure. Bleeding, bruising, or redness at the injection site is common. You might also see a drop of liquid come out of the injection site. This is common and should not be of any concern. After injecting. If your progesterone vial still has medication inside, store it at room temperature until your next dose. Great job! You have completed your injection. If you have any questions or need support, contact your healthcare provider or reach out to Fuze Health.